Good afternoon to everyone joining us today, and good morning and good evening to those of you joining us from outside the AP region. My name is Hae-young Yun, and I am the Managing Director of the International Cooperation and Capacity Building Department at KDI School of Public Policy and Management, located in Sejong, Korea. I'm also a member of the Global Development Learning Network, the GDLN Global Board, and the Global Secretariat. On behalf of KDI School and the GDLN, we want to thank everyone for their continuous support and interest in our GDLN Global Knowledge Sharing on the impact and responses to the coronavirus COVID-19 series. This is our 5th session in this series, and I'm happy to report that this is the first time we have been able to offer up the opportunity for a few students to actually sit in on the session for a face-to-face session in our classroom today. So we will be focusing specifically on Korea's experience in dealing with COVID-19 today. Korea has received its share of media attention from around the world with its relatively successful response to this pandemic without enforcing a full lockdown. We thought our GDLN community could benefit from hearing from our Korean experts today, who will speak about Korea's response strategy, how it's utilized ICT technology to battle this pandemic, and employed a policy of transparency when communicating with its citizens. Now, before I introduce our first speaker today, I think I need to remind those of you who are using the WebEx to mute your mics when you're not speaking, and then to unmute them when you do start to speak in order for our WebEx to run smoothly. As for our questions and answers, we ask that those who are joining us via the YouTube streaming that you identify yourselves in the comments section and ask your questions there. And then given the amount of time left, we will take source questions from there and also from our classroom at KDI School. And with that, I'd like to introduce to you our first speaker. Professor Dong-hyun Kim is the director of the Institute of Clinical Epidemiology and former dean of the Hallam Graduate School of Health Sciences, Hallam University College of Medicine. Professor Kim will be speaking today on COVID-19 as a public health crisis and response strategy in Korea. Over to you, Professor Kim, and thank you for joining us today.
The title of my talk is COVID-19 as public health crisis and response strategy in Korea. I'm going to talk about the global pattern and of COVID-19, and then I'm going to talk about response strategy, and then I'd like to talk about preparedness plan for second wave, and then conclusion. So this slide shows the new daily confirmed cases worldwide. So as you see this graph, we don't think we are passing the peak. So we are still in the middle of the first peak of the COVID-19. This slide shows the epicenter of COVID-19 is moving from one continent to another continent. In the earlier period, as you all know, China was the epicenter, and then it moves to the European country, and then North America, United States. But currently, South America, especially the Brazil, and then India appears to be epicenters of this COVID-19. So, and this slide shows the case fatality rate due to COVID-19. There appears wide variabilities in these rates. Italy shows the highest rate of case fatality rate, and South Korea is maintained this rate in 2.3 or 4%. As another indicators to assess the population and clinical impact of this COVID-19 is the population deaths per million. So case fatality rate is based on the number of cases in the denominator, but in this population rate, the denominator is number of population per million. So it gives us some different meaning of how the COVID-19 is affecting the population of each country. So this slide shows many European countries, the death rate per million is high, about 100 per million. But some Asian countries, Japan, South Korea, and China, the range is around 10 deaths per million. And then another Asian countries, Thailand, Sri Lanka, and Taiwan, is below 1 per million. So the most of the death rate per million is lower in Asian country compared with those of European countries. This shows the clinical progress of COVID-19 patient from the beginning to the end. This pattern is based on Chinese experience. So 80% of the cases, COVID-19 cases, were in mild cases at the time of diagnosis. 20% severe, and 5% can be assigned to clinical phase. But some of the patients, which was mild and moderate cases, finally went to the death, went to dying from the COVID-19. So we cannot, so it's hard to say that even if his or her symptom is mild at the time of diagnosis, their prognosis is good. This slide shows the major routes of transmission of COVID-19 in Korea. I think this the major routes of transmission will be similar in other countries. The church service gathering is one of the notable place to be transmitted. And then healthcare settings, including hospitals, long-term care facilities, and nursing home as well. And the other place for transmission is the densely populated place, such as the call center and the distribution logistics centers. And recently, we experienced a big outbreak in nightclub entertainment. So, and then the family transmission is also openly reported. So we think we can say there are 3 C's in the facilities with higher risk. It's a crowdedness, close contact, and closed space. So from now, I'm going to talk about response strategy briefly. This shows the epidemic curve of this COVID-19 in Korea. So the testing capacity, testing kits was prepared before the first patient were notified in the public health authority. And then we experienced sharp surge in mid-February to early March. And then it seems to me we succeed in we bend this curve in 2 or 3 weeks. So there are many media coverage how and why we can control the epidemic curve in such a short time. So there may be some key factors contributing to control of COVID-19 outbreak in Korea. Testing, tracing and treatment, or the 3T is too much appreciated, and many countries is already performing this strategy and trying to adopt this strategy. Besides these 3Ts, we have the non-pharmaceutical intervention approach, such as personal protective measures and social distancing, in only social distancing. And then finally, I'd like to point out that we have a public health infrastructure. So let me skip this slide. So for the public health infrastructure, we have 250 public health centers in each county. So we can do early isolation of confirmed case and aggressive tracing, and then quarantine. Centers. So we have the public health workforce and the public health organization to do this kind of public health response. So I'm going to for the second wave in Korea. The ultimate goal of response, public health response against the epidemic, is flattening the curve. We may not eliminate the virus until it is developed. But so until then, we have to reduce the spread and then to minimize the health risk of patients through maintaining the health system. So the purpose, the ultimate goal is flattening, not eliminating. This one. So so the basic principle for public health crisis preparedness and response is all hazard approach. So we experienced more and COVID-19, and then next crisis will come. So we need to develop scenarios, and then we prepare better for the broad spectrum of potential risks. So it can be said that public health crisis all hands on. There are three issues. One is the medical issues. Second one is public health issues and social issues. Some of the medical and the public health issues here. There are for immediate preparedness and so in this preparedness, we have the plan to utilize capacity. And then second one is important. Second is to maintain the regular function of healthcare service. I'd like to talk about more later. For the public health preparedness, we need the surveillance and monitoring system for early detection of small clusters, efficient and epidemiologic investigation and contact tracing. Third one is corporate governance in local government. And then social issue, social domain as a social domain, we need to develop through civic participation, and then we need to develop a policy environment supporting crisis response. And the last domain is the R&D governance and roadmap for epidemiology, clinical, and the infection control research. So I would like to outline some key medical and public health factors which considered in preparing second wave in Korea. The first one is that we need to enhance capability of a public health response agency, the KCDC in Korea. There may be other agencies. Any central public health agency should have some capacities for strategic analysis and response policy decision, ongoing and emerging situation. Second one is we need to prepare healthcare capacities to cope with the patient source according to possible scenario. The third one is we need to strengthen or we need to rebuild the infrastructure for public health surveillance and monitoring for early detection of community clusters. Next one is in Korea, we are now trying to set up the public health preparedness in every county to maintain regular function of healthcare facilities. So the public health preparedness clinics is targeting for any patient with respiratory symptoms. So we are differentiate the patient with respiratory symptoms and the other regular patients to maintain the regular function of healthcare facilities. And then, as I said before, we need to develop operational capability and cooperate governance between central and local governments. So, okay, as I said, it is very important to maintain the regular healthcare in the middle of COVID-19 crisis. Many countries reported there are severe disruption to services for non-communicable disease in the period of communicable disease crisis. So there are some problem, healthcare service delivery problem for these patients with this kind of disease. So it is very crucial to maintain ICU and ER function for critical patients with other disease. So this shows the excess mortality beyond the mortality of COVID-19 in Scotland. There are excess mortality of all cause and cardiovascular disease. So, there are many deaths COVID-19, but there are much more deaths to another disease beyond the previous years level. So this is another data how excess mortality is observed in each country. So this slide shows when we are experiencing, our understanding is going. We are getting more and more knowledge on COVID-19 than before. We still have to know. We still have to know what kind of virus this is through this kind of research topics, research area. So let me conclude my talk. In summary, I'd like to point out 4 important points for fighting against COVID-19 through we have improving access to health coverage and workers' safety protections. Second one is investing in strengthening the public health infrastructure. Actually, this is the social issues. We have to expand the paid leave. So through this kind of social policy, we will prevent the spreading of the sick people to others. And then we have to check some high-risk facilities, whether they have exposed or not. So, okay, yeah. But uncertainties persist. There are many uncertainties about the COVID-19. We know that there are no statistically significant difference in and asymptomatic infections. So asymptomatic patient can spread the virus. And the percent of asymptomatic patients is very high. Some report is around 50%. 50% of patients is asymptomatic when diagnosed. And then, and then there are many studies, community-based studies, saying that infection is 50 much more widespread than indicated by the number of confirmed cases. And then, and then there is no evidence that use of serologic test can show that individual has immunity or is protected from reinfection. So Dr. Kissler at Harvard School of Public warned, even in the event of apparent elimination, the COVID-19 surveillance should be maintained since a resurgence in contagion could be possible as late as 2024 to 2024. So it's very worrisome warning to everybody. Okay, let me skip this one. So I think this is my last slide. I try to say that it ain't over until it is over. It's ongoing. So, prepare this crisis through solidarity with among countries. Thanks for your attention.
Thank you very much, Professor Kim. We'll take questions for his presentation at the end of after the 3 speakers have spoken. Now I'd like to move on to our second speaker for today, Mr. Songjun Che. He is the Director of the Multilateral Cooperation Division at the Ministry of Science and ICT in the Republic of Korea. Mr. Che was formerly the Assistant Secretary to the Secretary for Industrial Policy, Senior Presidential Secretary for Economic Affairs at the Office of the President. And with that, I'd like to introduce Mr. Choi, who will be speaking to us about Korea's response to COVID-19 with science and ICT. Over to you, Mr. Che.
Thank you. Good afternoon and good morning, everyone. I hope every one of you and your family stay healthy and safe. Okay. Korea has flattened the curve on COVID-19 without enforcing extreme measures that restrict freedom and movement of people. People say that this could be possible thanks to the massive scale testing, rigorous epidemiological investigation, transparent information sharing, citizens' voluntary cooperation, and as well as the dedication of the medical staffs. However, I'd like to add one more point that ICT played a key role in fighting against COVID-19 in Korea. With this presentation, I'll share with you the way how Korea used ICT to respond to COVID-19. Korea used ICT in every step of responding COVID-19. For the testing, some biotech companies used AI technologies and high-performance computing to develop COVID-19 test kits in a very short period of time. Other companies use AI technologies to support researchers and healthcare professionals in the diagnosis and screening of the patients. For the tracing, we have used a mobile app to effectively monitor those on the self-quarantine. We developed a computer-aided epidemiological investigation support system to quickly and accurately analyze the large amount of data. For the social distancing, we have used ICT to support remote learning or working and even religious services. We have used cell broadcasting service to help people informed the status of the coronavirus. From this slide, I like to talk about some specific examples of ICT utilization in responding COVID-19. Korea has conducted COVID-19 diagnostic testing to a wide range of public within a short period of time since the early stages of the spread of the virus. The massive scale of diagnostic testing is essential to minimizing the damage from this highly contagious virus. With R&D support and emergency use approval for medical devices, Korean government supported companies to rapidly develop test kits and launch them in the market. Some of these companies, like CZen, used high-performance computing and AI algorithms to dramatically shorten developing cycle. According to CZen, they developed a test kit in just 3 weeks, while it would have taken 2 to 3 months without AI system. Korea's AI-based medical image analysis companies provided their solutions to lower the medical staff's burden and to help doctors effectively diagnose the patients. Here, I would like to introduce 3 companies Medical IP, Vuno, and Lunit. The pictures in this slide are some screenshots of the medical IP's AI-assisted diagnosis software solution. Their solution can analyze CT scans within 1 minute and detect and quantify pneumonia lesions. The medical IP provides free download of this solution on their website. As of now, more than 1,100 institutions from 46 countries downloaded the solution. This slide shows the company Vuno's solution. Vuno developed an AI-based chest X-ray and CT scan reading solution. It can analyze chest X-rays within 5 seconds and CT scans within 1 minute. This solution is available on the company's website. This is the third solution provided by the company Lunit. Lunit's AI-based chest X-ray analysis software can analyze chest X-ray photographs within seconds. It guarantees 98% accuracy in detection of major abnormal lung conditions. This software is also available on Lunit's website. Hospitals in Korea and Brazil are using their software. Korean government enforced special entry procedure on April 1st that requires all inbound travelers to self-quarantine for 14 days. So the burden of the case officers who manage people on the self-quarantine were getting heavier. Therefore, the Korean government required all the self-quarantined people to install the self-quarantine safety app to help case officers effectively manage them. The self-quarantine safety app has 3 key functions. First one is a self-diagnosis function. Users check their symptoms twice a day and submit the results. Assigned case officers will be notified if users do not submit the self-diagnostic data or become symptomatic. Second one is a GPS-based location tracking to prevent possible violation of self-quarantine orders. If a user leaves his or her designated location, the app automatically notifies the case officer so that the case officer can take proper actions, like calling the user or police officers. And the third one is providing necessary information, including self-quarantine guidelines and contact information of the assigned government case officers. As of May 26th, more than 90% of inbound travelers to Korea have installed the application. With the help of this app, we could improve the management of inbound travelers and self-quarantined people. Contact tracing is an important part of epidemiological investigation. With the spike in the number of confirmed cases in February, there was a heavy workload for the epidemiological investigators. Korean government developed a computer-aided epidemiological investigation support system to quickly and accurately analyze the large amount of data. The KCDC, the Korea Centers for Disease Control and Prevention, operates the system in close coordination with the National Police Agency, telecommunications companies, and credit card companies. The system can quickly identify the transmission routes and places that the infected has visited by using real-time analysis of data such as GPS and credit card transaction history. Epidemiological investigation support system helped us to effectively analyze the movement of confirmed cases. But on the other hand, it caused privacy concerns. Because of the growing privacy concerns, the KCDC operates the system in a very strict manner to protect privacy. Access to the system is granted only to a few officials with different level of authority according to their duties. Abuse of personal information can be prevented as the activities of each user is under strict surveillance. All personal data stored in the system will be deleted after COVID-19 is over. As schools have been shut down due to COVID-19, students and teachers struggled with unprecedented online education. There are around 8.4 million students in Korea, including elementary, middle, high schools, and universities. Korean government provides the online learning management system of the EBS to help teachers and students meet virtually. EBS stands for the Korean Education Broadcasting System, which is a public broadcasting company. To support online education, central and local government, telecom providers, and ICT companies are gathering efforts. Telecom providers apply zero rating by exempting EBS website from data allowance, which means people can access to EBS website, not worrying about data charge. The government, Samsung, and LG Electronics collaborated to provide smart tablets to students from low-income families. To support remote working, telecom and web portal companies provide free video conferencing and remote working solutions since February. And the Korean government opened the website to provide information about companies providing solutions for remote working and their products. For the remote religious services, telecom companies provided 100 gigabyte data allowance to each religious organization to help them have virtual religious services. Korean government opened a call center to help the religious organizations to have online religious services. And when there is a request for technical assistance, government provides on-site technical supports. Korean government also allowed religious organizations to use FM broadcasting band for drive-through religious services. The picture here in this slide shows how the drive-through religious services are done. Korea uses cell broadcasting service to send out emergency alert messages to the public about the movement paths of the confirmed patients and COVID-19 safety measures. Local governments send out alert messages in cooperation with telecom companies to those in the transmission range of the virus. As almost all handsets, except for a few models, support cell broadcasting service as an obligation, it is very helpful for preventing the spread of the infectious diseases in Korea. Here are some examples of the COVID-19 emergence texts. Let me read a sample message sent by the Seoul Metropolitan Government. If you had visited blank blank building between March 3rd to 8th and have a fever or respiratory difficulties, please visit the screening center. Please wear a mask before the visit. With a surge in demand for untech digital services like remote learning and working, Korean government inspected the emergency response system of broadcasting and telecommunication service providers. Major telecommunications service providers have ensured that the movement paths of key facility management staff do not overlap to prevent the mass quarantine of staff at the same workplace. And in case of building shutdown, network operations will be remotely carried out. Although Korea's network capacity is not experiencing a shortage as of now, the government has ordered network providers to increase in the number of lines in preparation for a sudden surge in traffic. COVID-19 is a big threat to all humanity. With the presentation of Korea's experiencing with ICT to respond COVID-19, ICT is an effective tool to fight against pandemic. With the full use of ICT and proactive international cooperation, I hope we can overcome the pandemic shortly. Thank you very much. Thank you for your attention.
Great, thank you so much, Mr. Che. Now I'd like to go to our third speaker for today. Our third and final speaker is Professor Myung-jae Moon from Yonsei University. Professor Moon is the director of the Institute of Future Government and the vice president of Korean Association of Public Administration. Professor Moon will be talking to us today about Korea's agile adaptive approach, a policy of transparency and communicating risk, and citizens' voluntary cooperation. With that, if you could turn your attention back over to Sejong and Professor Moon's presentation. Thank you so much.
Okay, good afternoon and good evening and good morning, maybe somewhere. I'm Jae Moon. I'm a professor of public administration, Yonsei University, and dean of social science college at this, in the same university. And well, the Professor Kim and Director Choi covered public health crisis in South Korea and ICT applications. You know, my presentation somehow covered those aspects, and probably I can quickly go through that. Well, the presentation I'm going to make is really based on the article I published recently in a Public Administration Review, which is published by the American Society for Public Administration. Basically, I tried to address how Korean government did their strategies in response to COVID-19, particularly emphasizing the agility, the speed, and transparency and voluntary participation of the people. So I'll try to go over that aspect. Given 20 minutes, and I'll go through some of the slides that I prepared. Well, COVID-19, as Professor Kim mentioned, and Dr. Cho also touched upon, and what COVID-19 is very different from the previous viruses. And of course, there are similarities, but there are a lot of differences as well. So that I think we need to think about what would be the best strategies to responding COVID-19. Well, all countries are under the same test, and in fact, you know, I don't think there's any exception. And maybe there are some countries have, you know, less degree, but I think eventually they're going to take the same test. So COVID-19, well, some of the countries are doing good, and some of the countries suffering more than others. But I think we are going through it together. And I think this is the time that which strategy might be better than the other. And probably we need to figure out what should be done at the government level and individual level and societal level. So I think that's something that we want to talk about today. Well, COVID-19 is a wicked problem. I would say it's a global wicked problem in many ways. I'm sure that you know some of the characteristics of wicked problems. Wicked problems, basically, it's unstructured. It's not structured, so that it's moving, and it's not structured. It's fluid, so that it's much more difficult to solve than a structured problem. And also cross-boundary. It's very cross-boundary, so that not only one single sector or one single organization can solve it. It's a cross-boundary so that different actors, different sectors should work together, and even different countries should work together because of the nature of the infectious disease. And also broadly disagreeing. In fact, I remember at the beginning of the coronavirus, at the end of, late January, and I saw several people, even the medical side, and some of the people say, well, we should wear masks, and some other people, well, we don't have to. So that there were disagreement among different, even among the experts. So COVID-19, because we don't know the answer, and then there are broadly disagreeing in many ways. And also intertwined and trade-offs. For example, quarantine and lockdown, well, it's good for fighting against the COVID-19, but it affects the mobility and also economic activities of the people, so that we constantly fighting against the trade-offs that we should have. So I think there are a number of issues regarding policy instrument choices, and I think that's something that we need to think about. Multiplicative, so that there are different dimensions, different actors, so that that's another one. And also, again, unstructured and constantly changing. So those are some of the main characteristics, and I think COVID-19 has those characteristics. Global risk, this is the global risk by World Economic Forum. And in fact, this is the one, infectious disease, the high impact, in terms of the impact high, but it's less than climate change, for example. But, I think, COVID-19 might shifting to this direction. And I think the impact is getting higher. So that I think this will be the things that we need to figure out in terms of solutions. At the same time, hopefully we can get the solution as soon as possible. Take a look at this one compared to SARS and MERS, and I'm sure that you see this one, and you will see, how distinctive the COVID-19 is if you compare SARS and MERS. This is the, how much time it takes to get some of the cases, so that it's very steep and sharp, so that, 6 million cases in a little bit more than 5 months. So that it's very different in terms of speed and scope and scale. So that I think, that's how the strategy and decisions we make really affect the future. And in fact, the first confirmed case that we have in Korea is quite similar to the first case in the United States. But, the actions taken by two different governments and the strategies, initial strategies, and I think that made a really big difference. And COVID-19 in South Korea, I gonna skip. This is sort of total cases. The Professor Kim mentioned the flat, and I think that's something that we can say. And daily new cases in South Korea. This is the time that we had the Sincheonji high peak. and then ups and down a little bit, but still we are trying to struggling with the COVID-19. But in general, it's under control in many ways, though there's daily ups and downs. Well, this is something that I really want to draw your attention. This graph is a little bit different graphs that Professor Kim showed, and I think the data points are quite similar. But there are two things that I want to draw your attention. One is the x-axis, that's the proportion of confirmed patients to number of tests made in different countries. So that if you take very aggressive, proactive approach in testing people, and then you will move this direction to the going to zero. For example, Ecuador, France, and so that I think now if you have updated one, Brazil, and I think the update I got yesterday, if you get 2 tests and then 1 is confirmed cases, so that it's in a very high ratio. And this is the fatality rate, so that the proportion of death to the number of confirmed cases. So that if you go down to the 0 and then lower fertility rate. So as you see this, Korea is the corner to the low and left, which means that aggressive testing and then low fertility rate. Some of the countries over 0.15, so that 15%, very high fatality rate. In Korea, it's 2.3 fatality rate, so that different countries, and it seems to me that what kind of strategies you take, that affects the fatality rate. Of course, there are many other dimensions we need to think about, as Professor Kim mentioned, the medical capacity and social capacity and those things. But somehow the aggressiveness and agile responses and proactiveness really matter, particularly regarding COVID-19. Critical success factors, I already talked about some of the keys, but the way I phrase this one is Korean strategy is agile and adaptive approach, so that speed-wise is very agile, very fast actions taken. At the same time, there have been a number of changes and innovations made, so that agile at the same time adaptive, you're very changing, responding to COVID-19, because you don't know, it's not structured problem, so that you need to adapt to the new findings about the COVID-19. So I think it's a quite essential taking agile and adaptive approach. And the other one is policy versus science. I think it's really, really important, because you have policy community, at the same time you have science community. And COVID-19, there are a lot about scientific facts and findings. At the same time, you have a political context. So for example, when there was a peak in Korea, we had a general election, and that's a political dimension. If somebody want to incorporate or consider political implications, and then maybe the policy decision by the government and top policymakers, the decision might be polluted. So that I think it's really important how you really balance policy side and science side. So I think one of the things that the initial success that we had was that science wasn't overruled by policy making and politics. And some countries, I think there have been struggling between politics and policy and science. Sometimes politics overrule science, and then that caused and led to a big disaster. So that's something that we need to think about. And the other one is information and transparency, and I think this is really important. And Director Choi mentioned that how Korean government used and using ICT to share the information with the people and communicate with the people. Risk of communication is very, very essential. On the one hand, if you are too transparent and let people know how many cases you have, how many confirmed patients here and there, and then people will be feared, and that might affect the level of public trust in government. Maybe it goes down and lower the public trust. But at the end, transparency wins. So I think the information sharing with the people and communicating with the people is really essential. And so transparency really matters. I'll give you another aspect on that. And the other one is governance and participation. Government cannot solve COVID-19. And I mentioned that the transboundary issue and transboundary nature of the wicked problem. And citizen participation is also very, very important. The critical factors, 3T, which is medical side, testing, tracing, and treatment. And I think that's, to me, that's very, very important, 3 Ts. And the other 3 Ts, technology, which ICT, we heard a lot. And then transparency, which really lead to public trust in government. Recently, I analyzed one survey data, the data collected from the Korean people who were victims of social disaster. There are some questions like, how do you comply government's campaigns or government's requests? And the level of public trust really was the key determining factor, which really affect to what extent you really want to comply with what government wants or government asks you to do. So that the public trust in government is really essential. And there are 3 A's also very, very important. As I mentioned, agility, and then adaptability, and then administrative, social, and citizen ability, in other words, capacity. So that I think those are some of the essential 3T, 3A's. Well, this one, agile side, is agile responses, and how fast the Korean government moved from the level 1 alert level to the level 4, which is the highest level. And the first case we had was January 20th, and then we moved from blue level to yellow. And then there was a peak and the spread of a new infectious disease, and government responded, and we raised the level to orange level. And then, so that's January 27th. So that January 20th and then January 27th, in 1 week, we leveled up. And then February 23rd, 2020, that's the highest level. And that's the time that government decided to have the red level, and then Central Disaster and Safety Management Headquarters led by the Prime Minister. So that in government really put all the government energies to respond to COVID-19. And this is the one that I want to look. And I think, if you are familiar with the organizational learning, and there is a single loop and then double loop learning. And single loop learning is basically, are we doing the right thing? So that if you know something you need to do, and then that's basically a single loop. So that if you are dealing with a very structured problem, and then the single loop is okay. So if, as far as we are doing right things right, and then it's okay. But COVID-19, it's not structured, and then it's something that we still figure out. So the double loop is very, very important. Are we doing the right thing? Some of the question that we are asking all the time. But there is literature only on single loop and double loop learning. But to me, COVID-19 still challenging us, and I think we need to go through triple loop learning and then quadruple loop learning, because we are still working on continuous organizational learning because of the constant adaptive measures to be taken by government and by the medical society. So that I think, single loop, double loop, they are not enough, and triple loop, working on the context, that's not enough, and then quadruple loop learning, asking for continuous organizational learning, and then constant adaptation, that's very, very critical. Transparency and trust, this is something that I mentioned. As you have more the transparency policy position, initially it might be trust deficit suffering because of the lowering the public trust, but at the end, you will have the public trust, so that surplus. So, how transparency policy position is important. Information and transparency, I already mentioned a lot, and there are a lot of apps available. COVID-19 Finder and facial mask apps, and it's quite interesting. Facial mask apps, the app actually developed in 3 days. Of course, before releasing the public open data, there were some issues and tensions between government and then drugstores, but eventually once the data was open, and then there are people who develop app in only 3 days. So I think working with the citizens and group of people out there is very, very essential. So open data, APIs and app-based services, that's something I should say as an example of co-production, not just by government, but citizens out there. Political context and policymakers, and policy versus science is very, very important, as I mentioned. And the last one, governance and participation. I don't think the COVID-19 can be solved by government. Government did a very good job, but nonprofit organizations, medical society communities, and citizen participation in non-pharmaceutical interventions, so-called NPIs, sanitization and social distancing, and still that's very, very important. I think voluntary citizen participation and awareness is really, really essential. So I think this citizen participation, I cannot say, I cannot emphasize more. Well, this is the last one. Agulo, this is the map in New York City, and maybe you haven't heard about Agulo, which is a fake town. A long time ago, 1930s, there's a map company. They tried to sell the map, but they concerned about somebody copy their map and put in the market, so that the one staff member got a really good idea. Well, put this small Agulo as a fake town and then sell the map, so that if somebody copied their map, and then that's the proof of copying, infringement of their map, their copyright. So that several years later, they found maps with Agulo, but which were not the map that they made and produced. So that they tried to sue the company, and then they shocked because they found Agulo was there. And they tried to investigate. What happened was that later there's a gas station and convenience store named Agulo. So that it started as Agulo, the fake town, but later Agulo was created. Of course, small town. The reason why I'm saying this is that, well, we are talking about new approach, agile, adaptive. It sounds like not the way the government operates, but I think that's something that we need to think about in the future. And this is my last slide. Jim Collins' Good to Great, the first sentence of the book, of the Good to Great. And I like this expression, good is the enemy of great. So COVID-19 is still, we are going through, and the Korean government has been doing good, but I think we shouldn't stop here, because we need to reach the great stage, and good is the enemy of great. So that's something that we need to keep reminding ourselves. Thank you.
Great. Thank you so much, Professor Moon. I'd like to actually stay with you guys over in Sejong and revert back to you for our first question. I understand there's a question from a student in the room.
Oh, and thank you for the presentations, were really insightful. My question is for Director Choi, to Director Choi, and I want to know how the government managed the incentives of if there were any compensations for the private companies that got involved in the strategy, in the technological strategy for COVID. Mainly in the case of education, I could see that Samsung and LG Electronics collaborated with the government in the provision of the smart tablets. And how was this process? Because in Ecuador, I'm from Ecuador, we're struggling with education, and we are a rural country in most of the provinces. So, but we still cannot connect the public sector with the private companies to provide the technical infrastructure that students and professors and teachers need. Thank you.
Thank you for the question. Can we go over to Director Choi? Can you respond?
Okay. Actually, the government didn't provide any incentives to the companies because the companies, telecom companies, and LG Electronics and Samsung Electronics, they also wanted to do good things to the people in this pandemic era. So the government don't need to give something good to them. Okay, this could be your answer.
And probably I just want to add a little bit. I think there is a lot of companies, they have doing things as part of the corporate social responsibility, CSR. At the same time, some of the apps developed by not big companies, but small group of people, for example, and that's really based on the open data initiatives. So, for example, if you go to open data website, there are a lot of data opened by the government. And now 2,700 apps developed based on open data. And in fact, for example, the facial mask finder, which I mentioned, and that's based on open data. And there are 100 apps and APIs available and developed and used by different people. So that's not by the government money spent for that. Basically, government provide the data, and then there are a group of people, they develop the app. For example, the Corona map, first developed by the group of college students. That's also based on the information and data opened by the government, but the group of people, they developed.
Thank you very much. We have a question, I believe this is from Thailand, for Professor Kim. How much does international travel affect the spread of the virus? And this is, again, from a participant from Thailand who, where there is a lockdown and their borders have been shut down. So that was a question directed to you. Can I go back to you, Professor Kim?
Okay. Actually, I have an idea exactly the number on how the inbound travelers spread the virus to Korean residents. But initially, we did not close our border to other countries, especially China. But in the sometime we implemented the quarantine system for the inbound travelers. So we we distributed the computer app as the Director Choi said. We distributed the application for inbound to inbound travelers to know how their symptom is developing, and then we requested them to stay at home or stay at some residential facility for 2 weeks. So I think the effect of the inbound travelers is not so great. Yeah, I think there may be some, but the impact, I don't think the impact is great. Yeah, most of the Korean epidemic, which we experienced in early February, middle February, and early March, is actually there was surge of patients. The cases occurred in among the Korean people, Korean facilities. So I think the effect from the inbound travelers is limited.
Thank you, Dr. Kim. Actually, there's one more question for you since I have you from Uganda about masks. So he says that we've heard lots about the benefits of wearing a mask to cover your mouth and your nose, but he's curious as to whether or not there is a need to protect actually our eyes as well in terms of the spread of this virus. Can you comment on that?
Yes, but if we wear some device, if we wear some device to cover our eyes, I think the compliance may be very low. I don't think the virus can be transmitted. There may be some viruses in eye, such as conjunctiva, but I don't think it has some potential to the virus in the eye transmit to others. So wearing the mask is wearing the mask all the time is the best way to prevent the spreading to others.
Thank you very much. Now I'd like to go back to Director Choi. There is a question from one of our YouTube viewers about how much of this technology that you spoke of during your presentation is available for developing countries to either have access to or for exportation. Can you comment on that, please? Thank you.
Well, I think actually most of the technologies can be adopted by the developing countries, but I'm not sure that if there are some restrictions for the like epidemiological investigation support system. This system could be applied to the society like where the infrastructure like the credit card. In Korea, most of the people use credit cards, and there are a lot of the base stations, like mobile base stations, in most of the territory. we need, we can detect somebody where is the location. But I'm not sure other countries, the situation is somewhat different from us. But basically, they can adopt our technologies, but the efficiency could be different.
Okay, thank you so much. And one final question for Professor Moon. This is a question, I believe, from a viewer in Egypt. How do we develop this the three A's that you speak of in countries like his or her own, specifically talking about Egypt? This agile adaptive strategy.
Well, the three A's, agile, in a number of cases, sometimes the tensions and conflicts among different agencies might delay the decision-making processes, and I think that's one things that we need to caution, so that inter-agency conflict, at the same time coordination with other actors and sectors. For example, if you have tracing and then treatment of patients, and then you need to work with the local governments and then hospitals, for example, in different communities, and that delayed a lot of procedures. So that it's not just somebody make a quick decision and that won't work. And I think a coordination and the way you really building consensus is really essential. So that I would say it's not easy, but I think because of the nature of COVID-19, that's something that we need to as a homework. So at the same time, I should say adaptability is very, very important, because once you make a very quick, agile decision, it might be wrong and you might make mistakes. So that I think there should be room for adaptation and changing. So I think that's something that we need to be very flexible in decision making. So the agility requires some flexibility.
Great, thank you so much. There are a couple of more questions remaining, but given the limited amount of time, I think what we'll do is we'll take those, and as we've done in our previous sessions, source them to our respective speakers, and you can find their responses on our GDLN.org, global.org website. So what I'd like to do now is just close today's session, and first close by thanking all of our speakers. Those of you who are joining us for the first time, if you're interested in learning more about GDLN, please do not hesitate to visit us at our GDLNglobal.org website for more information, and maybe even learn how to become a member of the GDLN. And please stay tuned and check out the website and our GDLN Global Facebook page for more updates and additional information. We will continue to have other sessions planned throughout the year. And if you want any more updates on the GDLN activities, those are the two places you should be looking, gdlnglobal.org and our Facebook page. Once again, let me thank all of our speakers today, Director Choi, Dr. Kim, and Professor Moon. I know you are all very, very busy, and we really appreciate your time always. So thank you so much for joining us, and our apologies for any technical difficulties you may have had. And with that, I'd like to say thank you to our listeners and our viewers today as well, and our GDLN community. Hope to see you all soon. Stay safe and keep washing those hands. Thank you so much. Bye-bye.